Good morning, everyone, and welcome to the October Health Chats, where we'll be covering an important subject, diabetes prevention. I am Maribel Ochoa, co-host of Health Chats, along with the lovely Dr. Rosemary Koo. Before we get started, I just quickly wanted to thank our corporate sponsors, Cyan Medical, Elite Wellness, Gallagher Benefits, and Blue Shield of California. With that, the mic's all yours, Rosemary.
Great. Thanks so much, Maribel. And thank you everyone for joining us this morning. At this point in time in our country, about 1 out of 10 people have diabetes, and about 1 out of 3 people actually have prediabetes. Those numbers are pretty staggering to begin with, but most likely over the next few years, we're actually going to be seeing a surge of diabetes and prediabetes because of all the lifestyle risk factors that have increased during the pandemic. And then also, to make matters worse, we're just starting to learn that having COVID, being infected, even if you had a mild illness in and of itself, could actually increase your risk of developing diabetes as soon as within a few months of having the illness. And if you had a more severe illness of COVID, such as the one requiring hospitalization or intensive care, your risk of developing diabetes and other chronic conditions also increases too. So this is a condition that we have to all be aware of. Even if you had a normal A1C or were screened for diabetes even a year ago, you might want to consider getting screened again and on a regular basis, just in case your metabolism has changed since then. So during today's health chats, we're going to be talking about what causes diabetes, the impact of lifestyle on your blood glucose levels or blood sugar levels. And if you do have diabetes, I'll go over the key preventive health measures that you should be aware of. I'll also talk to you about the Livongo program and then end with United Ag Resources. And we'll also have some time for Q&A at the end. So to start off with, most people are aware that diabetes causes elevated blood sugar levels or blood glucose. But how does that happen? And it all has to do with your hormone insulin. Insulin is produced by your pancreas, and it's the main hormone that controls your blood sugar levels. Insulin basically tells your blood sugar after you've eaten something. So when your blood sugars rise, insulin levels rise as well, and tells the blood glucose to basically go into your different tissues of the body, such as your liver, muscle, and also fat. And so insulin is the main hormone that controls your blood sugar. In type 1 diabetes, an autoimmune disease occurs where basically the immune system of your body actually attacks the cells of your pancreas and kills them to produce insulin in type 1 diabetes. This is why all type 1 people with diabetes, type 1, have to have some sort of insulin. Usually they're on an insulin pump to supply that level of insulin throughout the whole day. Now, in type 2 diabetes, this is the type that's lifestyle driven. It often develops later in life, and it's one where you don't necessarily have to be on insulin. The reason why type 2 develops is because of a process called insulin resistance. It's basically where your body is still able to produce the insulin, but the cells that need to absorb the glucose aren't listening to the insulin signal anymore. And so over time, your body tries to pump out more and more insulin to control the blood glucose, but it's no longer able to. And so your blood glucose levels get higher and higher. In the beginning of type 2 diabetes, you might be able to control the disease through lifestyle change or oral medications such as pills or tablets. But later on, your cells of the pancreas can also die as well. So similar to the process in type 1 diabetes. And if that starts to happen, then your body is not able to produce as much insulin as well. So not only are your cells not as responsive to insulin, but your body can also not really keep up with the demand. And at that point, you might need to inject insulin. That's really more advanced diabetes. And if your diabetes is caught early enough, especially if it's in the pre-diabetes stage, you can certainly reverse this process to make sure that you never need to be on insulin. So there are a lot of risk factors for developing diabetes. A lot of those are things like family history and genetics that you can't control. Also, if you have prediabetes or if you've had gestational diabetes during a pregnancy, you're also at elevated risk of developing type 2 diabetes. But there are a lot of factors, especially in lifestyle, that you can control. And we'll go over this here. So first is actually exercise. When you exercise your body and you're using your muscles, it forces your muscles to absorb more of the glucose in your bloodstream. So this is actually directly counteracting any of the insulin resistance. This is actually increasing your insulin sensitivity. And when people start thinking about an exercise program, it can be really daunting, but you don't have to, work up to being a marathon runner or anything like that. You can actually just start with really small steps, such as just walking. If you don't normally walk, even a short walk of 10 minutes a day is a great start. And so don't think that you have to create this huge goal for yourself. Starting small and just being a little bit more active each day will build up your cardiovascular conditioning, and then you can build up on that in the future. If you're already comfortable with walking, the next best step to increase your insulin sensitivity is to actually increase the intensity of what you're doing. So you might not necessarily need to increase your exercise time, but you might want to consider doing intervals where you're working more intensely, such as sprinting or running upstairs, jumping jacks, jogging in place, that kind of stuff to get your heart rate up for a short period of time, even just 1 or 2 minutes, and then decreasing the intensity for another few minutes, and then increasing the intensity again. That type of interval training is incredibly effective for reducing your blood sugars and reducing insulin resistance without taking up much of your time. Regarding your diet, most people are aware that you shouldn't have much sugary foods because that directly increases your blood sugar. And with all of those blood sugar spikes, your body is forced to secrete more insulin. And over time, if this keeps on happening, you'll become more insulin resistant. And so with your diet, you really want to focus on the sugar, but there are a lot of hidden sugars and foods that you might not be aware of that could be really easy to cut out. And for most people, that's actually in beverages. So I've seen a lot of people get amazing results with their diabetes just by cutting out the sugar in their drinks. And this includes sports drinks, juices, and also coffee-related drinks. So like lattes or frappuccinos have a ton of sugar in them, and you might not even be aware of it. Regarding juices, a lot of juices say there's no sugar added, and that might actually make you feel better about it. But juice in and of itself actually has a ton of sugar in it, even if the manufacturers don't add additional sugar. And so if you're craving juice, you might actually just want to have the fruit instead. So getting rid of sugary beverages, whether that's sugar added or not sugar added for juices, can make a huge difference in your blood glucose levels and insulin resistance. And sleep is another area that has a huge impact on blood sugar levels that people don't necessarily think about. So when you're not sleeping well, it actually places a huge stress on your body and causes a lot of hormonal dysfunction. So much so that in studies, if they've shown that with rats, if you actually sleep deprive them for a certain amount of time, the cells of their pancreas that secrete insulin actually die. And so this is really scary because a lot of us don't get adequate sleep on a regular basis. And if it's severe enough, we could actually be killing our pancreas, which will increase our risk of diabetes. In addition, not sleeping enough does actually raise your blood glucose levels because of the stress of having to stay awake. And we've seen this in shift workers. So people such as like healthcare workers, if you're working in a factory or manufacturing where you're working odd shifts, or you're having to work on schedules where your sleep cycle changes a lot throughout the day, maybe you're working the third shift, then that actually has been shown to increase risk of diabetes over time. So it's so important to have at least 7 to 9 hours of regular sleep each night. If you know that you're snoring during your sleep, or if you're waking up feeling unrested, even though you had at least 7 hours of sleep, you might want to consider getting screened for sleep apnea. A lot of people have sleep apnea, they don't know it, but as soon as they get treated, they almost immediately feel better, more rested, and it has a dramatic impact on lowering blood sugar levels and also blood pressure as well. And then lastly, stress is a really big component of diabetes risk. And as I mentioned earlier with sleep, stress increases the hormones in your body that basically prepare your body to fight or flight. And those hormones directly increase your blood glucose levels. So if you think about it, back to caveman times, if you see a tiger and you need to run away, your body needs fuel. And so our bodies are designed under stress to actually release more glucose. And then at the same time, our bodies are also designed to not absorb that glucose because we want the glucose to stay in the bloodstream. You want that fuel readily available. So all the tissues in your body actually become more resistant to insulin. So stress not only causes your blood glucose levels to surge up, but they also cause your body to become more insulin resistant. So it's not able to absorb that glucose. This is all designed well and good when, we were in times where we had to run away from dangers. But right now, a lot of the chronic stress that we experience in life is not a danger that we need to run away from. It's a chronic stress, one that causes us actually to be more sedentary. So you can imagine with this kind of constant flooding of the stress hormones that increase blood glucose and decrease your insulin sensitivity, that causes a huge increase in your diabetes risk. So if you do develop diabetes, the elevated blood sugars can cause damage to your blood vessels over time. And therefore, you have to be screened for additional health risks along the way. If your doctor doesn't mention these things, you should ask them about it. But these are things that you should be aware of. The first is getting your A1C tested regularly. Now, all of us should have this screening done on a regular basis, regardless. But if you have diabetes, you might actually need it more often. You might need to get it checked every 6 months or every 3 months, especially if your A1C is elevated. Now, your A1C is a measure of your blood glucose over the last 3 months. So it's a really simple blood test. You don't even need to fast to have it done. And it's a great measure of where your diabetes is. Are you in the controlled range? Are you not controlled? Are you in the prediabetes range? How are you doing in terms of lifestyle and your medications? And so if it's highly elevated to begin with, your doctor might want to have it checked as early as 3 months to make sure medications and the lifestyle changes that you're putting into action are actually working. So if you do have diabetes, talk to your doctor about when you need to get your A1C checked. This could also be a highly motivating factor, as if you know you have your A1C scheduled in 3 months, then you know you have a certain amount of time to try to improve your lifestyle and get that number back down. Another thing that you want to make sure that you're screened for is hypertension or high blood pressure. Hypertension and diabetes often go hand in hand, and together they're kind of like a double whammy for your blood vessels. They really increase risk of inflammation that can lead to things like heart attack, stroke, and kidney disease. So you want to make sure that your blood pressure is well controlled, especially if you have diabetes. Luckily, the bright spot here is that all of the lifestyle changes that you'll want to make if you do have diabetes also help blood pressure. So you don't necessarily have to do different things to help improve your blood pressure. You just have to do, kind of all the similar things like reducing sugar, improving your cardiovascular health, getting enough sleep, and minimizing your stress. Also, you want to make sure that you get your cholesterol levels screened, and your doctor might need to put you on certain medications to lower your bad cholesterol or LDL cholesterol. Also, a number in your cholesterol panel that you might be less aware of is actually your HDL or your good cholesterol. And as important as it is to lower your quote unquote bad cholesterol, it's equally as important to increase your good cholesterol, or HDL. So if you see your blood report and it says that your HDL is too low, talk to your doctor about how you can increase it. For most people, increasing your good cholesterol is really a matter of having healthier fats, from plant-based fats, and also actually exercise. Exercise is a great way, especially cardiovascular exercise, to increase your HDL, or good cholesterol. As I mentioned earlier, having diabetes and hypertension is kind of like a double whammy for other chronic conditions. One of the top chronic conditions that is caused by diabetes and hypertension is kidney disease. This is certainly a silent killer. Most people in this country who have kidney disease actually don't know they have it. And so it can actually be quite severe without having any symptoms attached to it. So that's why it's so important, if you do have diabetes, to be screened for chronic kidney disease on a regular basis, once a year. It's usually just a simple blood test they can add to your normal panel. Your doctor also may want to check your urine for any protein in there. So it's very easy to screen for chronic kidney disease. And if you catch it early enough, you can make sure it doesn't progress. If it does progress, you might need to be on dialysis or transplant, and both of those are life-saving treatments, but they're also life-changing. But the good news is if you catch chronic kidney disease early enough, and if you control your other chronic conditions, you can actually reduce your risk of ever needing dialysis or kidney transplant. Retinopathy is a disease of your eyes. It's a disease of the small blood vessels of your eyes, and this is also easily screened for. But you do have to have the screening done because diabetes is one of the leading causes of blindness. If you do have retinopathy, it's quite easily treated and effectively treated with laser treatments. So you just need to see an eye specialist and it can be managed, but it's most important that you actually catch it early on so that it can be effectively treated. And then neuropathy is another condition that you want to make sure you get screened for. This is basically nerve damage. Doctors are usually most concerned about the nerves in your feet, because if you have numbness in your feet and you get an injury, you might not know, and say you get a cut, it could actually get easily infected, and then you might not know it, or you might not go seek care for that injury. So it's really important that your doctor checks to make sure you still have sensitivity in your nerves, and that you haven't developed nerve damage or neuropathy. And then lastly, I just want to go over some key vaccines that you'll want to be aware of if you or your loved one has diabetes. Right now, the COVID-19 updated boosters are readily available. So make sure you get the updated booster if you do have diabetes or pre-diabetes. And actually everyone should get their updated booster, but if you have a chronic condition, it's even more important in your case. The flu vaccines are also readily available as well, and United Ag is organizing flu shot campaigns. So if you're interested in that, talk to our member services or Maribel. And then another vaccine to kind of be aware of is the pneumonia vaccine. Typically, this isn't given until people when they're past the age of 65, but if you have diabetes or other chronic conditions, you might be eligible to getting that earlier. So talk to your doctor about which vaccines you need. All right, so I'm going to go into our Livongo program to help people manage their diabetes. If you have diabetes, you can enroll in Livongo at no added cost. And once you enroll, you get a free meter and free test strips. You get a really nice package actually. And it's all sent to your house. It's super easy to set up, and you can use the meter to track your blood glucose levels. All of the data is updated to an app, so you can also see it not only in the glucose meter, but also in an app that you can download onto your smartphone. You can also set your language preference to Spanish if you prefer. And this is a great way to keep track of what your blood sugars are doing. It can also help you understand what factors increase or decrease your blood glucose levels. And while some people think of checking their blood glucose levels as kind of like, kind of like a stick, like it's negative reinforcement, like you eat something bad, or, you were sedentary and you check and you see it goes up and it's like negative reinforcement, but it doesn't have to be that way. If you check your blood glucose levels regularly, you can actually see progress. And so think of it more of a carrot. So if you are putting these lifestyle changes into effect, you can see progress in your blood glucose levels, possibly even within a few days. That's a very tight feedback cycle. So you can start learning what works for you. If you have that latte from Starbucks and that shot up your blood sugar, then you can't have it, or you can only have part of it instead. If you see that if you didn't sleep well and your blood glucose goes up, now you know what you can change. And say you start exercising and you see your blood glucose levels go down. That's highly motivating to have that tight feedback cycle. A lot of people rely on weight loss for that feedback cycle, but as many of you probably appreciate, if you start trying to lose weight, your weight is probably going to be steady for some time. It's probably going to be stable. You might not see weight loss within a few days or even a few weeks. If you're starting a weight training program, you might actually even see your weight go up. But blood glucose is different. You get kind of pretty immediate feedback as to whether what you're doing is working. So it's a great way to kind of monitor your progress. In addition, Livongo's platform, the data in Livongo's platform, if you check your blood glucose levels, can be accessed by our clinicians at the health and wellness centers, and also by the nutritionists and lifestyle coaches. And so it's a really easy way to share data with your provider. They don't have to ask you to bring in, a paper log of your blood glucose levels. They can just go in the portal and see how you're doing. So it's a nice integrated system for monitoring your diabetes. And here you can see how to sign up. There are multiple ways. You can text, go online, or call to enroll in Livongo. Again, it's free. All the devices and strips are free as well. In addition, if you have diabetes, prediabetes, or you just want to lose weight, or you have any other chronic conditions, definitely consider signing up for the lifestyle coaching program through our health and wellness centers. The nutritionists in this program are fantastic. They will work with you as often as you want to. If you want to follow up weekly, they can do that. And they're really there to support you as you're kind of identifying what changes you want to make, and they can follow up with you on your progress. They can also work with your provider. If you see the health and wellness centers for primary care, they can also work with your provider to adjust any medications that might be necessary. In addition, Teladoc has a wonderful nutrition service. So if you want to get tips on how to eat better, or you want an analysis of, whether what you're eating is good for your chronic conditions or not, please go ahead and reach out to Teladoc. And as I mentioned earlier, stress has a huge impact on blood sugar levels, and poor mental health is a very big part of stress. And so if you ever don't feel well emotionally, you need mental health support, please reach out to Teladoc for their one-on-one services. They also have My Strength, which is a program that's designed to build resilience to help boost your mental health and ability to tackle stresses in everyday life. So we have a lot of support programs for you if you have diabetes or at risk. And as I said in the beginning, your metabolism might be different now than it was even 1 or 2 years ago. So even if you might not think you have diabetes, it's always a good idea to get screened. If you do have diabetes, there are so many resources we have at United Ag to help you control the condition so that you don't have to worry as much about the potential negative consequences of diabetes. And with that, we will open up the floor to questions.
I just want to mention, feel free to raise your hand and I will gladly unmute you. We would love to hear from you, but I believe we already have one question, Rosemary.
Oh, great. Thank you for the question. The question is, what is your take on low glycemic sugars? Example, agave nectar and sugar alternatives such as stevia or Splenda. This is a great question. There's actually a lot of controversy over it. Some of the artificial sweeteners, like chemical sweeteners such as Splenda, have been shown to actually increase blood glucose levels or actually increase insulin resistance. It's not well understood though. Stevia seems in general pretty benign. And agave is a little bit tricky because of the high fructose levels, which means that it's digested in your liver in a little bit of a different way than normal sugar that could actually harm your liver but we don't actually know yet. The thing about agave is that it is sweeter than normal sugar though. So you might actually be able to get away with less. So there's a lot of nuances around these sugar alternatives or low glycemic sugars. The best way to kind of move forward with a decision for yourself is to actually, connect with either a nutritionist at the health and wellness programs or talk to your doctor to consider what are your other conditions or health risks. And also you might want to try different ones to figure out your preferences as well. Great question.
Don't be shy. Resmi, I wanted to say everything you talked about today, I can totally relate.
Oh, yeah, it affects us all.
Another question.
Great. And the question is, not sure if you covered it yet, but how much does family history affect diabetes risk? Another great question. Family history has a huge impact on diabetes risk. And so, even if you don't have the classic risk factors of diabetes, like if you have a normal weight, you're physically active and you're eating well, if you have a very strong history of diabetes in your family, you still may want to get screened. There's a huge genetic component, but it's not necessarily, it's not determinant of your future though. So if you do have that family history, you can still avoid getting diabetes if you lead a healthy lifestyle, but you do want to make sure you get screened for it.
I was going to say, are there any warning signs that maybe my sugar levels are too high, maybe experiencing fatigue, or is there anything like that we should be aware of?
That's a great question, Maribel. Yes, for most people, diabetes and prediabetes doesn't have symptoms, but there are a few that people might experience. One is actually a darkening of the color of the skin in your folds, such as at the back of the neck or armpits or groin area. That's something called acanthosis nigricans, and that's actually a sign of insulin resistance. So that's one that people don't often think of. Also, if blood sugars are getting higher, you might experience increase in thirst. And also increase in urination as well. And then, certainly if you're kind of experiencing other symptoms like fatigue, nausea, also a lot of unexplained weight loss, you're going to want to talk to your doctor. I've seen actually quite a few patients who have had long-standing diabetes. They didn't know they had it, and then they suddenly drop a lot of weight. And that weight loss is actually because their diabetes has worsened so much that they can't produce much insulin. And so they're acting a bit more like a type 1 diabetic than a type 2. So all those things you're going to want to talk to your doctor about. If you're concerned, if you're just not feeling well and you're concerned about it, like I said, it's so easy to be screened for diabetes. Just ask your doctor to order you the blood test, and then you'll know.
I have another question. Can poor gut health trigger diabetes?
That's an area that we're not sure about. It's definitely a rapidly evolving area with understanding gut health and your metabolism.
Mhm.
Also, gut health impacts your immune system as well. And both your metabolism and immune system, if they are not functioning well, can increase your diabetes risk. So most likely there is some linkage there between gut health and diabetes risk. Some of the data is unclear whether it's a chicken or the egg phenomenon, but we will probably learn more in the coming years. But regardless, all the things that people should do to optimize their gut health, like eating, fibrous vegetables, exercising, decreasing stress, all of that's good for gut health is also good for your metabolism. So it'll also decrease your diabetes risk.
Goes back to the saying, you are what you eat.
Exactly. That is absolutely right.
Awesome. Any other questions?
Oh, great. Yep. Here's a last question. Has there been any studies regarding having COVID-19 and increased risk of diabetes? Unfortunately, yes. We're just starting to understand long COVID. Also, we're starting to talk about as like medium COVID if it's within a few months, or post-COVID syndrome. But it has been pretty well established now that having COVID does increase your risk of developing diabetes, even as soon as within a few months. Right now, clinical practice hasn't necessarily changed. So your doctor might not say you have to be screened for diabetes after having COVID, but it's a good idea to ask your doctor to get checked out, especially if you haven't had your A1C done within the last year. So more on that to come in the coming months or years. We'll have a better sense of the impact there.
Well, thank you so much, Rosemary. And actually touching a little bit more about the importance of food and how it impacts your health. December 15th, we'll be covering how to improve your eating habits. Very key during the holidays.
I look forward to seeing you all then.
Absolutely. I hope you join us December 15th at 10 a.m. And once again, a reminder, all of these health chats are available on demand. So we encourage you to share the link with your workforce, with your friends, your family. Spread the word, spread the education. It's the only way we're going to battle these conditions. With that, thank you, everyone. Have a wonderful week.
Thank you. Bye.
Bye.